Hello, everybody, and thank you for joining me in this short video presentation from ECG Exercises. I hope you will enjoy this short video and join me here in my future video presentations. If you are new to my channel, please do not forget to subscribe. The ECG in ECG exercise number 29 belongs to an 82-year-old woman who diagnosed with pancreatic carcinoma and received chemotherapy with different agents, including gemcitabine. After that, during chemotherapy, she developed frequent polymorphic VT and external defibrillation, and after that was referred to our intensive care for further evaluation and treatment. Here we see the ECG upon arrival at the intensive care, which showed sinus bradycardia, prolonged QT interval, almost 630, corrected QT interval, 630 milliseconds, and sinus bradycardia. In this ECG, we see one premature atrial contraction marked with the blue arrow, and after that we see a normal QT interval and also polarity, a dramatic change in the QT interval and also the polarity of the T wave. So we had two questions regarding this ECG. The question number one was why the QT interval is prolonged. And we know that gemcitabine inhibits and modifies the human rapid delayed rectifier potassium channel. And based on this effect, the repolarization is prolonged. So we had prolonged QT interval and also giant negative P wave. Then the second question was why the QT interval was normal and is normal after one premature atrial contraction. With premature atrial contraction, we have a much shorter interval between two QRS complex. And what happens when the intervals are shorter? We have an increase in the activity of delayed rapid rectifier potassium current, and at the same time, higher heart rate and also shorter intervals leads to decreased activity of delayed sodium current. And both these factors contributed to markedly shorter QT interval after one premature atrial contraction. It is very interesting. At the same day, at the intensive care, the patient developed atrial flutter, and suddenly, with a higher heart rate, the patient showed and corrected QT interval of 477 milliseconds. Exactly with the same mechanism, the higher heart rate increases the activity of the rapid delayed rectifier potassium channel and also decreases the activity of the delayed sodium current, and both two factors contribute to the decreased QT interval and almost normal QT interval during tachycardia. It is very interesting to see, even in this ECG, during longer QRS intervals, we have suddenly a prolonged QT interval after that. What happens with a longer interval? Then at the same time, we have a decreased delayed rectifier rapid potassium current and also increased delayed sodium current, and both contributes to increased QT interval immediately after prolonged RR intervals. The next slide, 2 days later, and corrected QT interval for 507, and shortly before discharge, the QT interval, corrected QT interval decreased to 437. To conclude, this ECG was an interesting ECG showing the gemcitabine effect on human delayed rectifier rapid potassium channel. So this effect is known, but more interesting was the rate dependency of these effects. And therefore we had shorter QT intervals and normal QT interval during tachycardia or premature atrial contractions. I hope you enjoyed this short video presentation, and I would like to invite you joining me here in my future videos. Thank you again for your attention.